PCOS, Polycystic Ovarian Syndrome, is a very common cause for female hair loss. And in our practice, we see a lot of women who come in who have widening of their part, they have recession of their temples, and they're just very, very frustrated with the hair loss that they're experiencing. And so PCOS happens to be a major cause for why a lot of women who are in their reproductive age are experiencing hair loss.
Today we're going to discuss what causes the hair loss in relation to the ovarian cysts that many of these women have, and they may not even be aware that they have cysts. And the second thing is we're going to talk about is the treatment. There are many treatment options out there that are effective and we believe are very helpful in terms of restoring your hair density. So how does this typically present? Many women, of course, present to our office with this hair loss, again in the central scalp, but they may also present with acne. They may have hair growth on their upper lip, on their chin, and they may complain of hair growth on their chest, and maybe increased hair growth in their groin. And so they're wondering what is going on. What the hell is going on here? I mean, I'm losing hair on my scalp. I got hair on my face. Please help me.
So luckily, the medical community has identified really the root cause for why you're experiencing this hair loss on your scalp and a stimulatory impact in terms of hair growth on your body. It's being caused by an uptick in testosterone, which is a male sex hormone, the uptick in dihydrotestosterone, DHT, which is a major contributor for hair loss, and also a decrease in a sex-binding globulin protein that usually eats up the DHT. And again, DHT is a major contributor to hair loss, so if you have a decrease in this sex-binding globulin protein, well, guess what? You're going to get more hair loss as a result. So that's really the major cause for why you're experiencing this hair loss on your scalp and hair growth on your body. We don't just look at the visual aspects of this condition, but we encourage you to also get blood work because that helps us to better identify whether the PCOS is causing your hair loss. And there's a few things that we want to look closely at.
So what we typically look for is the elevation of precursors to androgens in the bloodstream, and it stands for DHEAS. And that is a precursor of androgens, which are the male hormones that may stimulate your hair loss. In addition, we check for testosterone. We check for anemia as well, which may occur in PCOS because some people have irregular menstrual periods. And
as a result of PCOS.
Right, and so they may have anemia. And so we check the ferritin level. We check what's called TIBC, which is the iron levels. And we also check for vitamin deficiencies because occasionally people have vitamin deficiencies in D and B12. So those are easily correctable with vitamin supplements. So we don't want to miss anything. So we want to cover the bases, make sure that we're looking at the right entity, and guide you in the right direction.
We've discussed how to diagnose and identify whether you have PCOS, and we also touched upon the importance of doing blood work. I don't want you to give up hope. We're now going to discuss treatment options. And there are some great treatment options for you to use to address either the excessive hair growth that you're experiencing on your body or the hair loss that you're experiencing on your scalp. The number one way to treat PCOS is with oral contraceptives, birth control pills. And we like to put patients on third and fourth generation birth control pills because the first and second generation pills have progestins that have an androgen stimulatory impact, which will make the condition worse. It will cause excessive hair growth in areas you don't want hair, and it will cause hair loss on your scalp. So that is the number one way to address PCOS. But this is not the only way that we treat PCOS.
Usually, patients with polycystic ovary syndrome are also treated not only with the birth control pills, but in conjunction with that, they use a water pill or diuretic called spironolactone. And spironolactone actually was found to inhibit an enzyme which changes the testosterone into a more potent form, which is the DHT, which of course inhibits the hair growth on your head. So it is very effective in terms of treating patients with PCOS who have hair loss, and now it's used typically in conjunction with those oral contraceptives. Those third and fourth generation oral contraceptives are used in conjunction with this spironolactone, but some of the spironolactone in some patients has to be used with caution. What we mean by caution is that if you're thinking of getting pregnant,
Or you're pregnant.
or you're pregnant,
Or breastfeeding.
or breastfeeding, you have to stop using spironolactone because it can have genetic detrimental effects on the fetus. So we don't want patients to be on spironolactone if they're either thinking of getting pregnant or they are pregnant. They have to stop spironolactone immediately so that there's no effect on the fetus.
And usually, if you are on spironolactone, you're taking anywhere from 100 milligrams to 200 milligrams on a daily basis in conjunction with your birth control pills. But there are other ways we can also tackle treating your PCOS. Another way is with minoxidil, either oral or topical, to address the growth phase of your hair as well as help bring more blood circulation to the scalp. That's another way that we can add another medication to the mix to address your hair loss that you're experiencing on your scalp.
The last drug that we might want to consider is metformin, which was a pill used in, it is used in diabetics, and it was also found that it has a inhibitory effect on the androgens in the body and allows hair growth to occur. So metformin is also used to not only lower blood sugar, which can occur in patients with PCOS, but also allow hair growth to occur on their scalp and reduce hair on their body.
We know that hair loss is emotional, whether you're a female or a male. In terms of PCOS, this is a condition that impacts millions of women around the world, and it has an impact on their hair loss, on their scalp, and excessive hair growth on their body. You might be someone who doesn't even realize that you have PCOS. So we hope that this video helped illustrate and help point out your possible condition and what treatment options exist. Now, if we haven't addressed your questions and if you have anything that you want to ask us about PCOS and hair loss, please leave them in the comments below. We are here to help.